The hundreds of first responders and survivors of 9/11 attacks who now live in Southwest Florida are facing a new threat. They're especially vulnerable to COVID-19. Of course, that's a respiratory illness that could take an even deeper toll on their lungs, which took in all those toxins from the collapse of the buildings. Miana Massey with one man's personal story tonight.
I spoke with Walt Zalisco, retired chief of police for Jersey City's police department, as he details the jarring images of the morning of 9/11.
The first thing you're thinking of is trying to rescue people, help people. You're not thinking about yourself.
His team arriving by boat, as he says it was the only way in or out of New York City, only to be met with what he describes as a scene out of a horror movie.
So you're inhaling all of the pulverized concrete, the asbestos, the toxic fumes from the fire.
Thousands of Americans lost their lives that day, and even more left with lasting health impacts.
It wasn't until a few months later that you started to experience some breathing problems, a nagging cough, and it wasn't a few years later that I was diagnosed with cancer.
Many diagnosed with cancers and other conditions are particularly vulnerable as we fight the COVID-19 pandemic. Lawyer Michael Barish encouraging survivors to seek benefits and compensation provided by the National World Trade Center Health Program.
It's not just for firefighters and cops. It's for anyone who was in the 9/11 exposure zone, and that includes 300,000 downtown office workers and 50,000 students and teachers.
He reports dozens of his clients have lost their lives to COVID-19 due to already weakened immune systems, urging you to seek available resources proactively.
There are clinics all over that provide free health care, including mental care, but also pulmonary care.
A final reminder to protect yourself and others as we battle this virus.
Protect yourself, because you are at risk. Please take care of yourself.
In Lee County, Miana Massey, Fox 4, in your corner.